Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
Hello, everybody. Welcome back to the Health Upgrade Podcast. This is Dr. Habib, and I'm excited to dig into a topic that I think is of high importance and something that is often missed out when it comes to understanding the effects of concussion and even things like whiplash or sports injuries. And so I want to talk today about concussion, whiplash, and vagus nerve dysfunction. So I'm going to approach this a little bit as a chiropractor, because that's what I am. I'm trained as a chiropractor and have practiced functional medicine with a chiropractic mindset for quite a long time now. And so I want to discuss exactly what tends to happen here. So the basic overview here is that concussions disrupt vagal tone and autonomic regulation, creating a concept called autonomic concussion. And the way that this looks is with often cardiovascular and systemic symptoms that outlast, cognitive issues. And that's really where we tend to find people months and almost years after some of these injuries have occurred. So whiplash and craniocervical injuries, that's head and neck injuries, can further disturb cervical vagus nerve pathways. The vagus nerve, where it flows, where it's located, is in the neck. Very, very important to understand. And we want to talk today a little bit about where it's located, the effects that it can have when that area is injured, and as well the areas in the brainstem, because there is a very important component to injury of the brainstem through these whiplash and concussive or craniocervical injuries. So let's dig into these concepts. So in many of these situations, imaging often looks normal, and most people that have had some sort of head injury or some sort of concussion or a mild traumatic brain injury, what they're noticing is that the initial symptoms were mild, but months later, they're noticing that their heart is racing. They're still dealing with dizziness, with some anxiety, and intolerance to exercise, intolerance to the ability to get up and move as often as they want to. Sleep is heavily disturbed. These are huge issues. And so I want to reframe this for you to understand that concussion is not a simple bruising of the brain. It's not a brain bruise. It's actually an injury to the network of the nervous system that is involved in autonomic function. That's the autonomic nervous system, and thus is going to have an effect on the vagus nerve's ability to create regulation below. Autonomic concussion is under-recognized, but it's a highly treatable component of concussion. And so what we're going to talk about today are kind of three things: the mechanism of vagus and autonomic nervous system disruption through these injuries, head and neck injuries, what the research shows in terms of diagnostics and symptomatic nature, and then therapeutics and how we can recognize it clinically and where treatment is heading, and some of the great tools and practices that we can utilize in a therapeutic manner. Okay? So let's dig into these mechanisms of injuries and the vagus nerve pathways that are involved when these types of injuries occur. So we often think of concussion as a diffuse injury of the brain, of the central nervous system within the head cavity. And that is a large component of it. But we have to remember the way that the brain is sitting within the cranial cavity, within the skull. So the brain has our kind of jelly center area within a larger cranial cavity. And then we've got the meninges that are around it. There's three layers of the meninges around the brain that are kind of connecting between the skull and the actual brain tissue, the soft tissue of the brain. And these meningeal layers are important in allowing for the flow of CSF, that is spinal fluid or craniospinal fluid, basically, that needs to run through cerebrospinal fluid, that's what it's called. And this CSF needs to flow through the meninges, and the meninges are, these three layers have different functions within there, partially to allow for fluid flow to occur, but also to create kind of a suspension of the brain within the cranial cavity without a physical connection to the brain. So it's creating this network-based connection to the brain. That allows for the brain within the cranial cavity to move around a little bit. It is a little bit like jelly inside of a bowl. If you ever think of Jell-O inside of a bowl, and when the Jell-O is made inside that bowl, you can kind of shake it and you have that shaking occurring. The brain actually has that same structure or that same fluidity. Obviously not to the fluids sense, but it's just a simple analogy to understand. What is important to understand, though, is below the brain is where the brain stem is located. And the brain stem contains the important connections of the autonomic nervous system, particularly within the medulla oblongata area, or the medulla of the brain stem, are the nucleus tractus solitarius and the dorsal motor nucleus of vagus. And these are the two primary autonomic nervous system connections of the vagus nerve. And the brainstem, particularly at this area where the medulla is located, is heavily, tightly structured within the lower part of the cranium and the upper part of the cervical spine, COC1, C2, as we know it, anatomical structures. And what happens here is that area is tight and wound and a little bit more rigidly held than the brain above it. And that means that when the brain moves forward and backwards, the brain stem tends to move significantly less because it's more rigidly held. So in a situation where somebody hits their head or they have a car accident and their head flows forward and backwards in what we know as a whiplash type of injury, or even sideways, what we'll often get is called a shearing force. And that's a pulling or a stretching at the area that's rigidly held relative to the area that's not rigidly held. So the brain can kind of jiggle around above while the brain stem holds tight. But what that means is the structures inside, which are the axons and the nuclei where all of the connections are occurring for those nerves, get stretched, pulled, and sometimes torn, depending on the mechanism of injury, depending on the angles, depending on the severity and the speed at which these injuries are occurring. And what that does is it physically shuts down the ability for vagus nerve connections to occur, which lead to dominance of the sympathetic nervous system. So the sympathetic nervous system, as an analogy, is kind of like the accelerator of the nervous system, and it pushes your body or your system function into what we know as kind of the fight or flight side of things, which is important. We want to be able to have that accelerator system work, but only when it has control through the brake system. We want to be able to push the accelerator, but only when the brakes are there to allow for control and for us to shut it down. The vagus nerve is that control mechanism. It's the brakes for this autonomic nervous system. And so when the brakes are damaged, are injured, are broken down, what happens is we're shifted heavily towards this fight or flight side of things. And what that shows up as when we go and we see our patients in practice is we see that their heart rate is increased, that they're hypervigilant, that they have pupils that are not dilating and constricting properly, that they tend to be in a much more dilated state because they're in threat response mode. And that's what sympathetic dominance does. We'll often see blood pressure responses are incredibly high. We tend to have higher blood pressure during these moments. And these microstructural damages trigger neuroinflammation, which impairs many different issues within the body. And so we create a neuroinflammation situation where people are dealing with cognitive issues. They're not thinking as clearly because the 80% plus of signals that come into the vagus nerve and go up to the central nervous system are not effectively going up there. And so we're not able to regulate the immune system within the brain. These are the microglial cells specifically. What that does is it decreases the amount of acetylcholine that's being produced, and we get more inflammatory reactivity within the brain. And so we start having cognitive issues, memory issues, don't remember where you parked your car, forgetting names, forgetting faces. really kind of minimally cognitive functional kind of challenges, but when we place them all together and we understand what's actually happening and where the root of this problem is, we understand that it comes down to injury of the vagus nerve or the vagus nerve and autonomic nuclei within the brainstem. So this is really important to understand. So the mechanisms where these types of injuries occur is particularly in whiplash or acceleration deceleration injuries. So this can be hitting your head during sports. Concussions and car accidents are kind of the most common, but slip and fall injuries will often result in these issues as well. What will also occur in these situations is damage to the upper cervical ligaments. These are the ligaments that hold the cranium, which is our skull, onto the upper cervical spinal areas. And the upper cervical spine and these ligaments are necessary in making sure that we don't have excessive motion level over level, and this leads to instability often. That can lead to a lot of other issues. And if you have instability, you'll notice it on what's called flexion extension x-rays reactions, and that's really important to understand. So we don't want these ligaments to become disrupted like they do in these situations. Muscles and facet joints will often change as well in these situations, and so seeing somebody that can assess this information or this type of challenge is very, very important to understand. This excessive neck motion can provoke some of these very important symptoms like dizziness, heart palpitations, often GI symptoms will follow, and a mood issue can often follow as well. Rightfully so, moving towards things like anxiety. Anxiety-like states due to these mechanical irritations of not only the vagus nerve, but of the stability of the cervical spine, the upper cervical spine. Upper cervical spinal issues are heavily, heavily overlooked when it comes to one of the root causes, the physical injuries that cause these vagus nerve dysfunctions. So let's talk about what we will often see in these autonomic concussion type systems or symptoms. One of the big things we'll see is tachycardia. And so this can happen whether resting or due to positional changes. So if you're laying down and your heart just starts racing or slowing down without any particular reason, or your blood pressure is often changing and you're noticing that you're just having these dizziness type symptoms and you're not able to regulate your heart rate during these situations. And often it's tough for you to figure out on your own. This will require things like wearable devices or blood pressure cuffs to help to fully understand. But this is one of the symptoms that we'll often find. Huge issue is something like exercise intolerance. You just feel crashed, incapable of handling excessive movement. You go to the grocery store and you're not even able to you sit down in the car and this minor exertion that you are completing becomes very challenging and your energy simply crashes after that. What you'll often also find is things like heat intolerance or abnormal sweating, sensitivity to different temperatures. You're not able to regulate your body temperature very well, and you're not understanding why that might be happening. The brain and the gut are so heavily connected that one of the more common issues that will pop up when you have a brain injury like a concussion or a TBI is GI issues, gastrointestinal issues. You'll find things like dysmotility happening. That means a lack of optimal movement through the gut. So often people will deal with constipation, diarrhea, nausea, early satiety, vomiting, things like that. They can come up pretty significantly. That gut-brain connection should be a huge red light for all of your clinicians to note that there is an autonomic link to how these things went down. One of the bigger issues is sleep disruption. We see this all the time. You're feeling wired and tired. There's panic episodes or a lot of anxious feelings around this. And it almost feels like these adrenaline surges are happening because all of a sudden you get these wired feelings. And it can often overlap with things like POTS, which is postural orthostatic tachycardia syndrome, and can be mislabeled as a purely psychiatric condition like a depression or an anxiety, because often that missing piece is, oh my goodness, I had a whiplash injury 6 months ago, or I had a concussion, a mild concussion that was overlooked, and that happened 8 months ago, or something like that. And that can be the root cause that's missing. So important to really understand. In athletes, something that I'm a big fan of taking a look at, and something that with wearable devices we can take a look at in everybody, is altered heart rate variability. So for those who have been listening to the podcast, you know, heart rate variability is the most important marker to understand autonomic balance. Autonomic balance tells us between the accelerator and the brakes, how easy can you pass between these two? Are you able to push the accelerator and then when necessary, push the brakes? And that means go between sympathetic and parasympathetic really effectively. And the higher your variability, higher your HRV, the more capable and more flexible your autonomic nervous system is. And so what we'll often see is concussed athletes and just general population, anybody that has a concussion or a TBI will have significantly lowered heart rate variability during their symptomatic and untreated phases. And it takes a long time to help build that up if you don't find it and work on it effectively. You'll often see these changes in heart rate responses. I say athletes because they tend to be tracking these markers a lot more readily. But now with things like Oura Ring, Whoop Band, Apple Watch, people are far more capable of getting this information in and knowing what their baseline is before something major occurs. And these changes, these issues can persist for a long time. They don't tend to be kind of 1 month or 2 months. It can take many months for these things to occur, even after the overt kind of cognitive symptoms are gone, especially when your body becomes exerted or you're dealing with cognitive stress. It becomes prevalent again. It comes back. It's something that does not go away as easily. Okay. There are some other tools that can be used to help diagnose these. Tilt tables, active stand testing to help reveal any orthostatic intolerances are great. Neck movement testing is really, really important as well to understand what's happening. Is there a vestibular component to this? Vestibular system is managing your balance. So that's an important one to take a look at. But of course, we don't want to do any excessive neck movements without properly analyzing the function and the capability of those ligaments in the upper cervical spine to create stability. So how these things are going to be tested for and assessed clinically include looking at orthostatic complaints, which is literally that balancing component. Are we noticing changes, huge jumps in your heart rates, dimming of your visual system, orthostatic lightheadedness? So you lay down, and once you get up from that laying down position, you become heavily lightheaded, or you can even faint or pass out just from sitting or from standing up. We tend to notice disproportionate flaring of these symptoms with exercise, with exertion overall, which will play a huge role, and then plugging it together with the gastrointestinal issues, potential temperature regulation issues, sleep dysregulation that all worsened after the concussion. And this is often overlaid by this anxiety or a mood instability, right? Unstable mood and anxiousness will often overlay on top of this and can be misdiagnosed because we tend to forget about the physical and the physiological symptoms that are affecting us because we tend to think very mood and emotional related first. Okay. Lots of great examination and practical tests can occur here. Orthostatic vital assessments, that's laying down to seated, laying down to standing, tilt table testing, like I mentioned earlier, and measuring heart rate or blood pressure is going to play a huge role, particularly with exaggerated rise in high blood pressure or heart rate overall. When it comes to exercise, we can grade the exercise and monitor heart rate and blood pressure and other symptoms as well, and HRV if we can as well, ideally. And even with mild exertion, you'll tend to notice that your heart rate is up, your blood pressure is up, some of these other symptoms are popping up, and HRV drops very, very quickly, or it remains low, because often we'll start with a very low HRV during these symptomatic times. A big piece to the puzzle, something that should never be missed by any clinician, and if they do, find a new clinician, please, is a cranial nerve screen. We want to do some neurological and cervical examination. We want to assess specifically. We've got 12 pairs of cranial nerves. Ideally, we're assessing all of them, but we want to pay heavy attention to the vagus-related signs. These are things like voice. So when it comes to the voice, we should be able to go really, really low or really, really high with the voice, and we should be able to have these peaks and valleys. And if our patient is speaking with a monotonous voice and unable to go high or low, or there's a lot of raspiness, or their voice is incapable of working up and down, that's going to be a sign that we should, as clinicians, be finding. We should be assessing your swallow reflex, your gag reflex, and your palatal movement. What that means is the palate at the back of your throat, the soft palate, when you say this is, when the doctor puts the tongue depressor in your mouth, pushes your tongue down and says, say what we're looking for is the palate, the soft tissue at the back of the throat, to rise about 1 centimeter equally on both sides at the back of the throat. If we don't see that, that's a sign of potentially vagus nerve, but other cranial nerve dysfunctions as well. So assessing those specific things with some what seem very basic tests can be a huge sign to tell us that the vagus nerve has been affected in some way. Upper cervical mobility, assessing what's going on with the upper neck motion pieces, what's happening with flexion and extension when we put our head forward or we look back or look and turn to the sides. What's happening with those specific things? Are we able to reproduce many of these symptoms? Is there any tenderness when the doctor palpates, which means they touch the areas around your neck? Are we looking for muscle tenderness, ligamentous tenderness? Even a lot of people that I've worked with that had concussions in the past could barely handle a little bit of tension or a little bit of pressure on the neck. And so that was huge there. Something that we really need to look for is that craniocervical instability where the ligaments are actually injured. Another area, the vagus nerve comes out of the brainstem at the nucleus troctus solitarius at the medulla area, and it actually courses down alongside your carotid artery and your jugular vein within your neck. When we have any tension or sensitivity over where we check our pulse, that could be a sign of a stretching or a shearing effect on the vagus nerve in the neck as well. And so extension or lateral motions tend to trigger a lot of that. It can also be because the muscles that overlie it, specifically the sternocleidomastoid, the SCM muscle, can be heavily affected in these situations. So assessing and addressing all of these are going to be really, really important. Now, when it comes to treatment, I'm going to talk about some of the basics, but often the basics are very difficult for people in this sympathetic, hyper-vigilant state to be able to complete. So one of the best ways to do this, and I realize this is something we talk a lot about, but one of the best therapies for this type of situation is actually non-invasive vagus nerve stimulation. What I have found is that regardless of the timeline, injury, post-concussion, regardless of the timeline, one of the quickest ways to get vagus nerve back up and running and to enable the body to get the vagus nerve repaired is stimulating the vagus nerve using electricity or ultrasound. I'm a big fan of electricity in this situation because it's these tools that are now readily available, handheld devices, are take-home devices. You can do this multiple times per day. And this is something that is a massive leap forward in concussion therapy and in whiplash therapy. Getting the body back to retraining and getting the brakes working again, using things like electricity help to then support a lot of the foundational things. Getting somebody who's had a concussion to focus on their breathing and do CO2 sensitive training can be very difficult because they have physical injuries. They're in an anxious state often, and creating these motions on their own without the support of vagus nerve stimulation tend to be very, very slow and very challenging. So I do want the breathing and the CO2 training to occur, but I need it to happen in conjunction with some sort of electrical or vagus nerve stimulation support. Biofeedback is huge and so powerful in getting HRV back up. But again, this is something that needs to be done in combination with vagus nerve stimulation. Okay. We don't want to push through some of those uncomfortable situations when we're dealing with this. So when it comes to autonomic and vestibular rehab, we want to have these exercise and retraining programs built around a graded response. We want to slowly build up, slowly build. We don't want to push through it, because if we overdo it, we're actually creating more of an issue for our bodies. Eye movements are a huge piece here. Oculomotor therapy for those with dizziness or visual motion sensitivity are very, very powerful. And where the big areas really focus is working to support light exposure, sleep, and daily routine stabilization, because the autonomic nervous system works on a circadian rhythm. And when sleep is disturbed as much as it is in these situations, it affects the ability to turn the vagus nerve back on, and it really affects the ability to enter healing state. We want to start with a lot of rest in an acute situation and then work towards rebuilding a lot of that vagus nerve capability while grading that exercise program back to a return to play or a return to work type of situation post-injury. Okay, so things we can't forget here. I'm going to start to wrap up this episode. We really want to focus on the mechanical cervical area, specifically in situations like whiplash, but making sure that the upper cervical mechanics are working well. See a good chiropractor, a sports-trained chiro, to help do some assessment to make sure that nothing is damaged according to these issues. If you can get an MRI, I'm more than happy for you to do so, because we really do want to know what's happening up there. We really want to focus on the fact that neck pain and whiplash and these injuries that can occur post-injury are not purely musculoskeletal. That's not just the muscles, ligaments, and bones that are affected, that the nerves can be heavily affected, and these autonomic nervous system type symptoms and vagus nerve dysfunction tend to occur in conjunction with these issues. So keep that at the top of your mind. And I just want to have a few key take-home messages here. Concussions often include a significant autonomic or vagal component, which explain many mysterious systemic symptoms. Don't forget about the vagus nerve when you're dealing with concussion. If you've had a concussion, you've had some sort of vagus nerve or autonomic dysfunction with that. I've worked with numerous clients that have had concussions. I remember one in particular came to me after her 9th concussion. She was a former world figure skating champion and many years ago, and had continued on the ice, but had a lot of slip and fall injuries during her time on the ice and concussions that followed with that. And the first massive shift that she was able to notice was about 6 weeks into her therapy, when vagus nerve stimulation was included in this care protocol. And that's where her gut symptoms started to get better. Her mood started to get better. This is a very common occurrence, sadly, and something that cannot be overlooked is this autonomic dysfunction. When it comes to whiplash and upper cervical issues, mechanical movements can aggravate these autonomic signs and symptoms. So even simple neck movements can trigger increases in heart rate or decreases in HRV or increases in blood pressure. So mechanically, we need to really assess high up. And then lastly, I want to focus on tools like heart rate variability, orthostatic testing, and symptom-guided exertion levels. We don't want to push well beyond where the symptoms are occurring, but noticing that exertion does trigger these symptoms is a huge piece of the puzzle. And if we target the vagus nerve during these therapeutic processes, using things like cervical rehabilitation, using things like vagus nerve stimulation, these are powerful avenues for assessment and recovery. I really want to focus on how important it is to assess and address the vagus nerve during concussion. So I hope this has been of high value to you. If you have suffered an injury like a concussion or whiplash, I highly, highly recommend getting an assessment done, timelining things out, having a doctor that knows what they're doing from a mechanical standpoint, talking to a chiropractor or a DO that is great at assessing the mechanical in combination with the autonomic, and that will be a huge piece to the puzzle. I hope you got a lot from this. Please share this with one person who you think could utilize this information, and we'll catch you all on the next episode soon. Bye.